LPN Practice Exam Nursing Study Guide and Review, 25 Challenging Questions. Question 1. A patient with cirrhosis has asterixis. This is a sign of low blood sugar, hepatic encephalopathy, kidney failure, heart failure. Asterixis, hand flapping, is caused by high ammonia levels in the brain. Question 2. What is the main concern for a patient with a crush injury to the leg? Infection, myoglobinuria and acute renal failure, diabetes, osteoarthritis. Muscle breakdown releases myoglobin, which can clog the kidneys. Question 3. A patient is in status epilepticus. What is the priority medication? Phenytoin, diazepam or lorazepam, valproic acid, aspirin. For benzodiazepines are the first-line treatment to stop active seizures. Question 4. Which assessment finding is expected in a patient with emphysema, thin frame and barrel chest, productive cough with green sputum, obesity and cyanosis, high blood pressure? Pink puffers, emphysema, are typically thin with a barrel chest and pursed lip breathing. Question 5. A patient has a pulsating mass in the abdomen. The nurse should palpate it deeply, auscultate for a bruit, massage it, apply heat. A pulsating mass suggests an abdominal aortic aneurysm, AAA. Deep palpation is contraindicated. Question 6. What is the therapeutic level for digoxin? 0.1 to 0.5 ing/ml, 0.8 to 2.0 ing/ml, 5.0 to 10.0 ing/ml, 20 to 30 ing/ml. The therapeutic range is narrow, typically 0.8 to 2.0 ing/ml. Question 7. Which condition is characterized by painless bright red vaginal bleeding in the third trimester? Placental abruption, placenta previa, ectopic pregnancy, preeclampsia. Placenta previa is painless, abruption is usually painful and rigid. Question 8. A patient with Addison's disease needs teaching on low-salt diet, lifetime hormone replacement, restricting fluids, avoiding exercise. Addison's involves adrenal insufficiency, requiring lifelong steroid replacement. Question 9. Which sign indicates pyloric stenosis in an infant? Projectile vomiting, current jelly stools, steatorrhea, ribbon-like stools. Projectile vomiting after feeding is the hallmark of pyloric stenosis. Question 10. A patient is receiving TPN, total parenteral nutrition. Which lab is monitored daily? White blood cell count, blood glucose, serum calcium, uric acid. TPN contains high concentrations of dextrose, requiring frequent glucose monitoring. Question 11. What is the silver lining or classic sign of carbon monoxide poisoning? Blue skin, cherry red skin color, pale skin, yellow skin. Cherry red mucous membranes and skin are signs of co-poisoning. Question 12. In a patient with a head injury, Cushing's triad involves tachycardia, hypotension, bradypnea, bradycardia, hypertension, irregular respirations. Tachycardia, hypertension, tachypnea, bradycardia, hypotension, tachypnea. Cushing's triad indicates increased intracranial pressure. Question 13. Which medication is contraindicated in children with a viral illness? Acetaminophen, aspirin, ibuprofen, amoxicillin. Aspirin use in children with viruses is linked to Reye's syndrome. Question 14. A patient with Graves' disease has exophthalmos. This means enlarged liver, bulging eyes, swollen ankles, hair loss. Exophthalmos is a common sign of hyperthyroidism. Question 15. What is the primary treatment for ventricular tachycardia in a stable patient? Defibrillation, amiodarone, atropine, epinephrine. Stable VT is treated with antiarrhythmics. Unstable VT requires cardioversion/defibrillation. Question 16. A patient has a positive MANTU (PPD) test. This means they have active TB, they have been exposed to TB, they are immune to TB, the test was faulty. A positive PPD indicates exposure/infection, not necessarily active disease. Question 17. Which type of isolation is used for shingles, disseminated herpes zoster? Standard only, droplet, airborne and contact, protective. Disseminated shingles requires both airborne and contact precautions. Question 18. A patient has a flail chest. The nurse observes symmetrical chest expansion, paradoxical chest movement, sunken chest, tracheal deviation. The injured segment moves inward on inspiration and outward on expiration. Question 19. What is the priority for a patient with a fat embolism from a femur fracture? Giving pain meds, applying a cast, oxygen administration, checking the pulse. Fat embolisms often travel to the lungs, causing respiratory distress. Question 20. A patient is taking phenelzyme and MAOI. They must avoid which food? Aged cheese and wine, fresh fruit, grilled chicken, potatoes. Tyramine-rich foods can cause a hypertensive crisis in patients on MAOIs.